For millions of Americans, hip pain caused by arthritis, a fracture, or other conditions can affect every aspect of their lives. If you're having hip pain, your doctor may recommend a number of treatment options. Some examples include rest, exercise, weight control, physical therapy, pain medications, non-drug pain relief, and nutritional supplements. There may be a point when these conservative methods of treatment are no longer effective. At that point, your doctor may recommend hip replacement surgery to help relieve hip pain and improve your freedom of movement. Over 250,000 hip replacement surgeries are performed each year in the United States alone. But many other patients who might also benefit from this procedure do not consider this treatment option because of fear, misinformation, or lack of awareness. The goal of this program is to help you better understand joint replacement surgery, including what to expect before, during, and after surgery. You'll hear from actual patients about their experience with joint replacement and how it has helped them return to an active lifestyle with less pain. As a ball and socket joint, the normal hip is capable of a wide range of motion. A rounded ball of bone at one end of the thigh bone or femur moves inside a cup-like socket that is part of the pelvis. Articular cartilage, which is smooth and firm, lines the socket and covers the ball. Normal cartilage allows the ball to glide smoothly within the socket to give you full motion of the hip and movement without pain. Arthritis is a condition where the cartilage lining of the hip joint wears out. The joint begins to move less smoothly, and you may begin experiencing pain, stiffness, and discomfort. Activities such as walking, stair climbing, getting up from a chair or out of the car, and prolonged standing may become difficult or impossible. The most common form of arthritis of the hip is degenerative or osteoarthritis, which is usually caused by wear and tear from overuse or trauma to the hip joint. Other problems such as rheumatoid disease or an injury may also damage the hip joint. Pain, along with a sensation of grinding and popping, can occur in the hip joint when the cartilage is worn. One bone rubbing directly against the other produces pain. The cause of the pain may not be obvious and may feel like a pulling sensation in the groin, or the pain may be felt in other joints such as the back. Your level of pain is one of the most important indications of the need for treatment. Many factors influence the decision to undergo joint replacement. A key question is how much pain is affecting your life, your ability to work, enjoy activities, perform simple movements like climbing stairs, or even sleep. Another question is whether you're getting enough relief from other treatments. Talking to your doctor and fully understanding the risks and benefits associated with the procedure is the best way to determine if hip replacement is right for you.
Why would anybody want to give up the ability to be mobile when they have an opportunity to do it? Like I just, this mobile, immobile, what are you going to be? I'm going to be mobile. I'm going to lead a good life. I mean, you only do this once. Why not take advantage of the technology that's created right now for us, and the expertise that's there, and it's only getting better. It's not getting worse, it's getting better. And I'm just glad I did it when I did it. And I wish that I would have done it earlier with my first hip replacement.
I was skiing. I was on a ski trip at Whistler, and I was on my favorite trail. And would normally take me about 15 minutes to make it from the bottom. It took me about 45 minutes because the pain was just so bad. And at that point, it was starting to affect other things that were pleasurable to me in my life. And it was at that point I decided that I was going to have my hip replaced.
Over time, the pain was so severe that it was almost constantly with me. So I was losing sleep at night, not able to sleep through the night, starting to have back pain and issues like that. It's living with pain like that makes you not a happy person, and it's hard to keep a good frame of mind a lot of times, especially at the end of the day when you've been working hard and you get home and you have other responsibilities. It weighs on you over time.
Obviously, you have doubts about doing it. You know, the very first thing that scares you is how painful it will be. You know, and then my doctor said, "Well, how much pain are you in right now?" And I said, "A lot." He says, "It'll be a lot less. We do this the right way. You follow my instructions, and you won't have any pain." That relieved a lot for me. Okay. Then the fear of giving up time. That was, after pain, the longest thing was how much time, because I'm coaching, you know, how can I fit this into my schedule and whatever. And they told me, look, for about a month, if you want to do this right, you follow everything completely right. It's going to kind of mobilize you a little bit. But if you do it right there, after another month, you're going to be really good.
Early diagnosis and proper treatment of hip arthritis is important for long-term mobility. If your doctor has recommended a hip replacement, it's important to understand that delaying surgery too long may reduce the success of your surgery. There is no cure for arthritis and its degeneration, which means that your pain and limited mobility are likely to get worse over time. Your hip joint is made up of two parts: the socket in your hip or pelvic bone and the ball at the top of your upper leg bone or femur. Your surgeon will make an incision to allow access to your hip joint. The surgical technique used and the length of the incision will be based on what your surgeon feels is right for you. Some surgeons now use minimally invasive surgery, which may involve a smaller incision and less disruption of muscle, tendons, and ligaments, and potentially a quicker recovery. Your surgeon will use special instruments to prepare your hip socket to fit the new components that will replace your diseased socket. A new cup will then be placed in the socket. The cup usually consists of a metal shell and a medical-grade plastic called polyethylene or a metal liner. Your surgeon will remove the head or ball of your femur and prepare your bone for the new femoral stem. The stem will support the new ball of your hip replacement. During the surgery, your surgeon will verify the correct fit and range of motion of the new component using trial implants. Next, your permanent hip stem will be implanted and the ball that sits at the top of the femoral stem will be put into place. Once your surgeon is satisfied with the position and movement of your new hip replacement, the joint will be flushed with cleansing fluid, and then your incision will be closed with surgical staples. You may have heard about hip resurfacing as an alternative to traditional hip replacement. Rather than removing the head of the femur, a metal cap is placed on the worn end of the femur, which fits into a metal cup in the pelvis. Designed to preserve bone, hip resurfacing is most commonly performed in younger patients with strong bone density and structure. Compared to traditional hip replacement, hip resurfacing may require a larger incision and the surgical procedure may take more time to complete because it is a more difficult procedure. A potential risk of hip resurfacing that does not occur with traditional hip replacement is fracture of the femoral neck, which connects the ball of the hip joint to the rest of the thigh bone. This risk may be related to preparing the bone, exposure during surgery, or placement of the cap. And because it is relatively new, the long-term success of this procedure is still unclear. However, the potential to retain bone is an attractive alternative to traditional hip replacement.